Good afternoon, everyone, and welcome to our Facebook Live. Today we're going to be talking about Enki Medical Centre, Handsworth Wood Medical Practice, and Laurie Pike Health Centre, about how we're going to be working more closely as those practices together. I'm just your really knowledgeable people in Birmingham to talk to you about that. I'll introduce them in a second. I'm going to share the presentation just to quickly go through the agenda today. So to start off with, we're going to set the scene. Then we're going to talk about the actual, what it means for the merging of the practices for Handsworth Wood, Laurie Pike and Enki. Then we'll move on to some frequently asked questions, things we think that you might want to ask given this process. There'll be opportunity at the end of the presentation to add your questions in the chat. You can do that right the way through. We will try and cover as many questions as possible before the end of the session. Quick update on Rapid Health so far and how that's going in practices and what's coming new in Rapid Health, and also an opportunity for people to get involved as a patient in our patient participation groups, and then we'll answer questions at the end. So to start off with, I'm going to stop sharing this so we can see people's faces and hand over to Meena to introduce herself.
Hello everybody, my name is Dr. Meena Gupta and I'm one of the doctors at Enki Medical Practice.
Simon?
Hi, my name is Dr. Simon Butler and I am one of the medical doctors at Handsworth Wood Medical Centre.
Tala?
Hi, my name is Dr. Talha Malik. I'm one of the GPs at Handsworth Wood Medical Centre.
And finally, last but not least, Maxine.
Hi, I'm Maxine Rowley and I'm the Division of Service Delivery Manager for Modality Birmingham.
Thanks everyone. So to start off with, I'm going to hand over to Simon to run through the first few slides.
Thank you, Lois. So I'm going to talk a little bit about our background and why we are talking about merging. Actually, in the background, Handsworth Medical Centre, Laurie Pike Health Centre and Enki Medical Centre have worked together for years, but we're on 3 separate contracts and therefore have 3 times as much administration to deal with. Now, I think everybody knows, you just have to look at the media, general practice is struggling everywhere across the UK due to a variety of factors, but in particular, we have huge issues around Birmingham with there being fewer GPs looking after greater numbers of patients. The NHS has taken on over 6 million extra patients in general practice since 2015. In the last 8 years, the number of GPs working full-time has been decreasing. And actually, some GPs are looking for different work-life balances. Some people are burning out. Some people are leaving the profession due to ill health. We've seen over 700 GP practices closing in England over the last 10 years due to recruitment, financial viability issues as main reasons. And now actually one full-time GP is responsible for nearly 20% more patients than they were doing 10 years ago. Fewer general practitioners in training want to become partners to run practice and deliver local change. I have to say, fortunately, within Birmingham, we're in a great position. We've just had a really successful recruitment round to fill all of our posts for general practice across all of our practices locally. Lois, can you click to the next slide, please? So this slide basically talks about appointments, and it is no surprise to anybody that our demand for appointments is increasing and is significantly increasing. This is everywhere across the United Kingdom. So you have a double-edged sword. You have fewer GPs and you have greater demand on GP services. And that just doesn't work. General practice is at the front door to the NHS, and anybody on any GP's registered list can book an appointment with their GP. Unfortunately, more appointments that are coming into us are actually about fixing other problems within the NHS. We all know about gigantic waiting lists in our system, especially at the hospitals, and this is something that's exponentially increased since COVID. More and more of our appointments in general practice aren't diagnosing and managing people with chronic diseases or acute problems. It's people coming into us because they're stuck on waiting lists or they're stuck within the hospital system. And it's very hard to get in contact with the hospital. It's much easier to make an appointment with your GP. We work in Handsworth Wood, in Handsworth, across Aston, across Ladywood, and actually these are considered deprived areas across Birmingham. Working in deprived areas has increasing issues associated with it. It's much harder to get clinical staff to work in deprived areas, and actually working in a deprived area creates increased health demands. We're working with fewer doctors, and we have more patients that need more help, maybe because of chronic diseases that aren't as apparent in affluent areas, or other issues caused by social or employment factors working in this part of Birmingham. So demand is huge. Can you click to the next slide, Lois? Compared to even 5 years ago, you will have heard about lots of new members of the general practice team. And we aren't general practitioners working in GP surgeries anymore. We are a GP team. And here are some of the names of some of the people that you may come across if you contact your GP surgery. This is as a result of the way government funding to the NHS has gone, and there has been a national drive to bring other clinical staff members into general practice surgeries. And these are really valued members of our teams, I have to say. Patients now may be offered appointments with their musculoskeletal practitioner or their clinical pharmacist to look after them. They are supported, they are trained individuals who are able to see you. It is not just a case of, I need to see a general practitioner in your GP surgery anymore. You will be seeing more and more of this across all surgeries nationwide. Now, some of our staff may work across multiple different sites to allow better access and more specialised care. For example, diabetes care or lung nurses at different sites. We all need to work smarter and more collaboratively to offer a better service for our patients. I have to say at that point, I'm going to pass over to Maxine Rowley, who is our Divisional Service Delivery Manager for Birmingham.
Thank you. I'm going to continue the presentation talking about the merger timeline. Next slide, please. Thank you, Lois. So I'm just going to run through some areas of periods of disruption that's going to impact on patients, and we really hope that you can bear with us while we work through this really important bit of merging the clinical systems behind the scene. So Handsworth Wood is joining Enki Medical Centre on Monday, the 24th of February. So appointments via Rapid Health will be booked on the day from Friday the 21st until Tuesday the 25th. This is to ensure that we can manage the workload and get everything done and keep everything moving operationally safely through all the areas of dealing with your appointment requests. What will happen is the NHS app, if you currently use it, access to your online access to your records will be disrupted between Monday the 24th from approximately 4 o'clock until Tuesday the 25th of February for both Handsworth Wood and Enki. You may, during this period of time, get a message sent from the NHS app, people, if you try to access it. It will actually say that the system is down at the moment during this time, and it may also say that you might need to contact your surgery should you need to have your ID sorted out on your clinical system. It's a may, it's going to happen. The other issue that we have is Voice Connect. If you currently use that for you ordering your prescriptions, from Monday the 24th, it will close at 3 o'clock, and it may require you to request a new PIN from Tuesday the 25th of February. For Handsworth Wood, Enki and Laurie Pike, your appointments for Rapid Health will then be booked on the day only on Friday the 28th of February until Tuesday the 4th of March. We're sorry to say that it does impact on Enki on both occasions, but we will keep it running as smoothly as possible. Your downtime for your NHS app and your online access to records will be Monday the 3rd of March until Tuesday, the 4th of March, from approximately 3 or 4 o'clock in the afternoon on the 3rd till about 10 o'clock on the 4th of March. And again, similarly, from Monday, the 3rd of March, Voice Connect will go down at 3 o'clock in the afternoon, and you may have to contact the surgery for your PIN to be reset. Next slide, please. So just to let you know what might happen post merger. So there will be a period of disruption to the services post merger. Because we will have to have a catch up for some of the service delivery that we give to you, like prescriptions, medication amendments from discharge letters, and any clinical administration. So for Handsworth Wood, it's going to be a period of disruption from approximately the 25th of May to the 7th of March. For Enki, it's going to be disrupted on 2 occasions, but less disruption will be from the 24th until the 26th of February, and then the 3rd until the 5th of March. And again, that's to do with the IT system behind the scenes merging and connecting as one. And for Laurie Pike, it will be from the 3rd of March until the 14th of March. We will have messages on our phone system, and we will get back to you as soon as possible with any of the requests that come through. And now I'm going to hand over to Dr. Meena Gupta for the next part of this presentation.
Thank you, Maxine. You move this. Thank you. Thank you, Lois. So as you've heard, we are planning to merge the 3 clinical systems into one clinical system. You've heard that there will be a period of disruption as both practices merge into the Enki system. So we're going live with Handsworth Wood first and then Laurie Pike after that. Now, that means that for us as doctors and administrators, there will be one site for all of the clinical team. For you booking appointments, it will not change. From the website, you will go onto the Enki website, and from there you will be able to access your own practice's booking site. So if you're currently at Enki, you will continue to book through the Enki Rapid Health link. If you're currently at Handsworth Wood, you will continue to book at Handsworth Wood Medical Centre, and the same for Laurie Pike. You will find your own links within that merged website to book at your own practice. So in many ways, you will not really see a difference in the way you book your appointments. In terms of Rapid Health, we've done quite a lot of work previously about filling in the forms and helping and supporting people to do that. And we will continue to make efforts to help show people how to fill the forms in correctly so that we can access the right information to make sure that you get to the best person to see you first time. So we're not wasting your time to try and get to the right clinical person to discuss your problems with. Just to say that registrations that are currently done online will continue to be done online. They won't change. Next slide, Lewis. Just again to reiterate that there will be very few changes in the general approach to the way the surgeries work. The catchment areas will stay the same. We will have the same telephone numbers. There will be no new links for Rapid Health, and you will still be able to see all of your records online using the NHS app or AirMid or whatever the system is that you use. Now, there may be a requirement on the AirMid access system to have to reset once the system updates and Handsworth Wood or Laurie Pike move over to the Enki site. Okay, the NHS app is the one that has least disruption when these types of service mergers happen. And as you probably have heard from reports in the newspapers that the government and Department of Health are really keen to promote the use of the NHS app, and soon you'll be able to book your appointments in the hospital with it, and you'll be able to see where you are on waiting lists. Not available yet, but that is in the offing. Now, in terms of what you can do with your, what we are planning to do with the way that we're changing our services is that, as Simon alluded to before, this way we can move our practitioners around to provide a similar level of service in all of the 3 sites. So currently you may be able to see a physiotherapist in one place, but you can't see them in another place. Our plan now is to make sure that you get that same level of clinical assessment from all 3 sites. So we will be moving our staff around to make sure that we have equitable access for all people in all the different sites. Next slide, Lewis. So there are a couple of questions in the chat about this as well. You know, why is this happening? Simon's already explained that we're doing this so that we can work in a more smart way. By combining our back office, we can actually make sure that we address all of the contractual issues we have in a much, much smoother way. And we'll be able to run one appointment system where we have oversight of everything that is happening everywhere to ensure that the right clinicians are in the right place at the right time to see patients. Okay, so we hope that this is going to improve the services that patients have. In terms of your prescriptions, your nominated pharmacy will remain your nominated pharmacy, but we have been told that due to the vagrancies of how the systems actually merge, some of the nominated pharmacies may be removed from your records. So we may have to renominate a pharmacy. So as we're issuing a repeat prescription to go to your nominated pharmacy, we may notice that that nominated pharmacy has been removed from your records, in which case we will have to call you to re-establish the nominated pharmacy you want. Now, if that was to happen, then obviously that's going to have a little bit of a delay in terms of getting your repeat prescription through to you. So I think those are the ends of my FAQs, and I think I'm going back to Maxine. Thank you.
Thanks, Mina. Okay, so we thought we'd take this opportunity to give a bit of a rapid health update as well. Because all of our 8 sites in our division are now live, and Enki, Handsworth Wood and Laurie Pike all went live during October. So the picture on the slide actually shows all 8 slides, all 8 practices. So just to give you an idea of the usage so far in December. We receive medical appointments, admin queries, and I think the main thing, while some patients do find the form frustrating to book, what it does allow is for patients to book their own appointments following that triage. And that's why the answering all of the questions are important, because the system allows you to be filtered through to, if you need an appointment, you can book an appointment of your choice. And it also gives you appointments with particular GPs or clinicians, if that's what you would like to do. We currently, for January, in January, to give you an example of the number of automated appointments booked, for Laurie Pike it was 19%, for Handsworth Wood it was 29%, and for Enki it was 37% of their appointments were booked automatically following completion of those forms. You will see that it's actually having such a great impact, and patients actually, when they are choosing their appointments, are actually looking to book between 3 and 7 days after completing their form. So just to give you a bit of an idea, and also to let you know that approximately 20% of our patients are booking their appointments sort of between 7 and 9 a.m. So it does give a wider area for the appointments and a fairer access system. Can we go on to the next slide, please? So the next slide actually shows you some of the impact that having Rapid Health is having on our phone system. We aim to, wherever possible, answer 80% of our calls within a reasonable time so that we do not keep people hanging on the phone any longer than they need to. And that's what the left-hand side is showing, some of the data from the 4 sites over a 12-month period. If you look on the right-hand side, actually what that's showing is how the orange line is showing, the dotted line is showing incoming calls and how they've dropped for the previous year. And the blue line, as you can see, there's been a significant drop on the phone lines since the implementation of Rapid Health from October. And what we are finding is Monday and Tuesdays are still our busiest days. But what we are finding is that it's actually getting quieter towards the end of the week. And there is becoming less of that 8 a.m. rush. And it is ensuring that actually a lot more people have access to booking an appointment by filling in the Rapid Health form. Next slide, please. So here's some of the patient feedback. We send out SMS surveys monthly around access. We send it to patients that have been seen in the previous 3 months. And this is some of the examples of the feedback that we've had for people that are enjoying being able to book their appointment online. Some are saying it's relatively easy. It does depend on the number of questions that you have to answer. It really depends on what you put in the beginning. So yes, there are some that may seem irrelevant, but they are all relevant to the clinical reason that you're putting in Rapid Health. We've got lots of people that are loving it. They think that it's an excellent service. It means that they can try and get an appointment before they go to work. And they know whether it's a telephone call or a face-to-face appointment. So it is making it easier. And patients are also enjoying the fact that the face-to-face appointments, they're getting longer with their clinician and can, spend some quality time and get their issues and problems sorted out during the consultation. Next slide, please. So we also don't ignore any negative feedback that we get. So this is really important that we continue to use and look at our feedback and improve our services. We do have frequently asked questions around Rapid Health on our websites. So I really encourage people, if they can, to go back and look at that. But we don't want people to think they're being excluded. If you're elderly, you don't have somebody that can help you. We're actually working with Age UK to try and get some digital workshops for our patients arranged so that they can give support around getting on the internet, actually going through the Rapid Health and the NHS app. And the NHS app is a really important bit, the thread that keeps linking through here. Some people are finding it challenging to have to fill in so many questions. It might take 3 to 5 minutes to fill those in. But like I said, they are really, really important. The more information you put on the form, the easier we can make sure that you'll signpost the most appropriate clinician, or one of our care coordinators can signpost you, maybe out to a community pharmacy to get seen sooner. So just a selection of sort of like the negative feedback that we are working on responding and not ignoring. Also, just to remind everyone that our telephone system does have a queue function and a callback function. So listen carefully to if you are phoning, because there's always an option to press that button. You don't lose your place in the queue. One of our team members will call you back. Keeps you in the queue, so just keep your phone beside you and we will call you back. Next slide, please. So we've launched this week Rapid Health for the under 16s. It went live on Monday, and it means that parents and guardians can submit requests for children under 16 via the Rapid Health form. This is going to make life a bit easier, I think, for parents that are trying to get children to school and off to work and that sort of thing. So there are 5 free text questions so that you need to put in there. Every request, it will then go to our duty GP at site, and they will look at it to prioritise it. And it may be that you are sent a link so that you can book an appointment, but you will be sent that link because someone has had a look at the information that you've shared. And please, if you are sent a feedback form, please send us. Please reply, and I think there are 5 questions that we ask you, and this will allow us to carry on improving our patient access and streamlining the care for you. So I'm now going to hand back to Mina.
Thank you, Maxine. We're trying to encourage patients to join our patient participation group. We would really like to hear from you. There've been lots and lots of comments in the chat about how we might improve. And if you have the time, we'd really like you to join our patient group. We are planning to use this group, not just to use it for a face-to-face meeting, but also to use it via virtual channels, so maybe a Teams meeting or whatever we find easy for patients to use, but to get you involved in learning from you about what you really want from your appointment system, your healthcare, would be absolutely fantastic. So there is an email address there for you to email us and let us know whether you would like to be involved. And as I say, as we start to roll this out, we plan to have both face-to-face and virtual meetings. And we really think that we would like your opinion and your views on how to shape our services going forward. Thank you.
Thanks, everybody. So that concludes our presentation. We've got some good questions in the chat. So if you have got a question and you haven't put it in the chat yet, please do add it there, and we will try and answer as many as we can before we finish. So please bear with us. I think Mina might have frozen, so I'm going to remove her. When she comes back in, I'll add her back in. Okay, so a few different questions, some on Rapid Health and some on the actual merger themselves. So one of the questions I should have answered at the very start as well and in the middle is that people are asking, is this going to be recorded? So this session is recorded and will be available after we finish, both on YouTube and Facebook. So if you've joined late, don't worry, you can catch up and look back. Also, people raised that the text on the presentation is quite small. So what we'll do is we'll try and find a way of sharing that as a link on with those recordings so that you can open it and see it in a bigger format on your screens. So hopefully that will help. Now, let's have a look. Questions. Someone asked, are we going to be writing out to patients and giving them information and telling them? Maxine, do you want to answer that one?
Yes, we will be sending out a patient letter. You will either receive it via a link via AccuRx, which a lot of our patients are familiar with. So that will come via a text message through the system. And for those that we don't have their mobile phone number, we will be posting out letters. They will be going out early next week.
Thank you, Maxine. And then also the time frames the timelines were quite hard to remember from what we'd said. So I think probably, Maxine, you and I could get together and do some notices for social media that are really clear about the timings and reminding people as they're coming up. So we'll take that action away, I think. So there's a question about, obviously there's fewer and fewer GPs and lots more people. How is merging going to help this current situation and make it better? Simon, do you want to take that one?
Absolutely. So we are fully staffed with GPs at each of our sites. Some of our sites are bigger, some of our sites are smaller. Just like all of our patients coming in the winter with coughs and colds and sickness, we have a higher sickness rate amongst our clinical staff and our admin staff at this time of the year as well. And actually being able to work across different sites means if one of our smaller sites is really down on staff, we can move people to try and stop letting services drop at different sites. I made a comment earlier about using specialist staff like our physiotherapists or our diabetes or our lung nurses, and actually being able to spread some of that skill across other sites as well. So I'm hoping this will make us more resilient and allow us to provide a better service to our patients. Just to be absolutely clear, your normal doctors at your normal sites will stay there. So you will have your same doctors at your normal sites for the majority of the time.
That's a good point. And is it also with, I think one of the points Mina raised was that actually exactly what you're saying, Simon, the same clinicians at the same sites. However, if it became that actually you needed a physio and it was available in another site, that's possible to go somewhere else. Is that correct?
That's right.
Okay, excellent. Thank you. So there's quite a lot of questions about Rapid Health and the frustration of filling out the form. So we should just tackle the elephant in the room. Who wants to take that one? Maxine, do you want to take it about how important it is, the form?
I'm happy to start and then get some input from both Tala and Simon. So Rapid Health allows fair access to our appointment system for everyone. The questions are really important, and you do have to fill them all in. I would appreciate that it takes 3 to 5 minutes, but what it enables us to do is for you to be either directed to an appointment, which you can choose, whether it's telephone or face-to-face. But the other thing is, if it does need to go to our duty doctor inbox, it actually goes set straight in your medical records as well. So it does allow the duty doctor to be able to prioritise as to whether you need to be seen same day, within 24 hours, or you could be sent a link to see somebody later in the week. Simon, Tala, do you want to add in the importance of all of those questions from a clinical aspect?
Absolutely. One of the things we're trying to do is make it easier for people. And I know everybody hates the telephones, and we've hopefully got rid, for the majority of people, the need to hang on the phone. Yes, it takes 3 to 5 minutes, but if you fill in your form correctly, you are more likely to be booked straight into an appointment. And actually, the way the system works is that it will triage you into the urgency at which you need an appointment. We've gone from a system by which everything was same day. Yes, through this you can book your appointment further ahead if your triage comes out as something that can wait.
That's great. Thanks, Simon. Is it worth reminding people when the merger changes are taking place, and also the under 16s form? Because the question in the chat about when is it actually going to happen, the changes for the merger?
So Rapid Health will be limited access. When I say limited access, there will be fewer appointments for you to pre-book. For Handsworth Wood and Enki, it will be from Friday the 21st of February until Tuesday the 25th of February. For Laurie Pike, it will be Laurie Pike and Enki. It will be Friday the 28th of February until Tuesday the 4th of March. And that's allowing us to make the changes within the IT system so that all the appointments sit where they need to sit post-merger of Handsworth Wood and Laurie Pike.
There's another question about repeat prescription service, because you mentioned a lot of different providers. One of the questions is about the AirMed app and needing to reset that for ordering their prescription. I'm not sure if you covered the AirMed app, but it's a way that patients can order their prescription through an app, isn't it? Is that affected by the change?
So there will be downtime that you can't access it due to the clinical systems merging. So again, for Handsworth Wood and for Enki, this will be from approximately 3 o'clock on the 24th of February until 10 o'clock on the 25th of February. For Laurie Pike and Enki, it will be from 3 o'clock on the 3rd of March until 10 o'clock on the 4th of March. Now, the clinical providers are actually saying there may be the need for us to reset your password So please just contact us. You can use Rapid Health for an admin reset, and we will prioritise that because we know that there may be an issue, and we don't want to stop anyone from getting their medication any longer than they have to.
Thank you. So a question's been asked about, with the changes happening, will there be any extra staff answering the phones at the different surgeries if they're to sort of patient queries, people concerned if they get on and they can't find the right Rapid Health link or something? Is there any plans for that?
So we do currently already support, our non-clinical staff do support one another across the different sites on the phones. One of the challenges we have at the moment, which is why the merger is going to make life so much easier, is that actually they have to keep logging in and out of each clinical system, whereas when we have merged, they will be able to help more smoothly because they will be looking at one clinical system. So yes, it will help. It will make life a bit smoother.
Thank you. So there's a question about being able to see people face to face. There shouldn't be any change, or is there any change to how patients appointments are delivered face to face to telephone?
I'll take that, and actually to say that we've actually used telephones quite a lot for years. Certainly about half of our patient appointments now are face-to-face again. Our telephone appointments go much faster than our face-to-face appointments. So we are all back in surgeries wanting to see patients face-to-face, and that's what half of our appointments are.
And there's a question about appointments and appointment links being sent out, and then when they got to it, it expired. Can anyone explain about the booking links for Rapid Health and how they kind of work for patients? So
if you've gone through a triage process and a doctor has sent you a link to book an appointment, that link is valid for 7 days. If it is an urgent appointment, and so you've been triaged into something that needs to be seen within the next 24 or 48 hours, you are informed that in the message, and the link will last for as the time period that you are supposed to be seen within. So the links last for 7 days for most appointments.
Thank you. And just to reassure again, there's a question about someone saying they've got a physio at St James's Medical Centre. Will this be available in podiatry at Summerfield Centre? So there should be no impact on existing provision of appointments at different sites locally.
That's right.
Okay, excellent. So let's scan down. Lots of good questions. Good question about pharmacists and being referred to pharmacies, community pharmacies for treatment, and what is actually available and what is suitable, and patients being concerned they might be pushed to a community pharmacy when it's not appropriate. Mina, would you like to answer?
Yeah, so this is a scheme that's been set up by NHS England, or the Department of Health, and what they are trying to do is they're trying to facilitate the use of pharmacies by people who have what they would call minor conditions. So if you've had a bit of a cough but you're not seriously unwell, if you've got a urinary tract infection but again you're not seriously unwell, the idea is that you go to your local pharmacist, and pharmacists have been trained in assessing these clinical conditions, and they will assess you and give you a prescription as necessary. Now, we have good communications with our pharmacists, so they are all our local pharmacists. If they see patients that they're not sure about or they feel are more unwell than initially thought, they will signpost them back to us. So there's good communication between the two sets of professionals. Obviously the pharmacies sit in their own pharmacies and we sit in the GP surgery, but we have really good links and communication with them. And equally, the pharmacists who sit within our practices, we employ a number of clinical pharmacists who also see patients. They are supervised by us. So we always have a supervising doctor, and it is always a supervising doctor within each of the sites who is there and available for queries and questions from any of the other different types of healthcare staff we have working there. So we do try to make sure that we link everybody together so that patients are kept safe and get the right care.
Thanks, Mina. Question about, just to reiterate again about Maxine, about the phone ordering prescription system called Voice Connect, and will that remain the same, and what impact might happen due to the merger?
Okay, so unfortunately, we do believe that your PIN numbers may not work, and they may need to be reset post the merge. So we have prepped all of our staff. Please just make a request and we will send out a new PIN number if it doesn't work when we have merged at each of the sites. We are aware that that could cause a problem. And we do have well over 3,500 patients that currently use that.
Yeah, it's a really good uptake. And if you don't use that service and you do find that easier than using an app or a phone and actually using just phoning up, it is really simple. I've used it for my daughter before. So please get in touch with the practice if you'd like to register for that service. Someone's asked to explain the appointment system using the under 16s form and how that is different to the current Rapid Health adult form. I don't know who would like to take that one.
I'm happy to go for it. So essentially, all under 16s that come through, the majority of them are maybe they've got fevers, they're acutely unwell. Kids get worse very quickly, and all under 16 triages that come through get seen by one of our duty doctors to make sure that they're fitted into the appropriate places for appointments.
That's great. There's a couple of questions about Rapid Health, and obviously not everybody is internet savvy, got a device. Maxine, could you provide some reassurance about how your reception team would be able to help those people?
Yeah, so all of our reception team are trained to help talk you through the form filling. For those, you will end up spending longer on the phone, but we want to make sure that everyone gets fair access. So if you don't have internet, please just call us and our reception team will fill in the form for you and make sure that you are contacted. If you don't have an email address, we will make sure that we actually contact you via your mobile, either by an SMS or by picking up the phone talking to you, and so you will not be missed.
Thanks, Maxine. There's a bit of a trend in the chat about mental health and the prioritisation of people needing mental health support. Simon, would you talk about how that works within Rapid Health in terms of how people are prioritised?
So when you fill in the questionnaires, if the computer is able to book you straight into an appointment because it is something that is routine or non-urgent, then it will do so. But if you have particular concerning features that come out of your questionnaire, again, your form is looked at by one of the doctors who will make sure you are sent a link for an appointment that's appropriate for your issues.
Thank you. There's, in response to one of the answers we gave about the under 16 forms and people calling the practice, people saying, I have to wait a long time on the queue. One of the reasons we are increasing our provision on Rapid Health to allow under 16s carers and parents and guardians to put in an online request is that should dramatically reduce our phone lines again, leaving them for the more vulnerable people or people who don't have access to a device to phone, which should make your call wait shorter. And Maxine and the team, I can reassure you, are constantly looking at the call wait time and the answer rate to make it as accessible for everyone as possible, just to provide that reassurance. It's not perfect anywhere in general practice, but working really, really hard to get that call and answer rate down for patients. Someone's asked about, they were concerned that they sometimes can be inappropriately seeing patients with clinicians they might feel aren't appropriate for what they've come in for. Can we provide some reassurance, like say if you were put with a pharmacist and then you met with a pharmacist and actually it needs some GP input, how does that work in the practice and how would that be escalated to a GP? Mina?
Well, we operate something called a huddle every day. So at 12 o'clock or 12:30, the whole clinical team comes together and those kinds of issues are usually raised at the huddle. So when I think about the last huddle, our pharmacist said, I saw a patient with this condition, I don't know how to deal with it. And so in the huddle, we discussed what we're going to do. Usually the answer is that the duty doctor will then take over the care of that patient and they will see them and sort them out. Now, whether that, when I say see them, I don't know whether that will be a face-to-face appointment or a telephone appointment. It depends on the clinical condition of the patient. But it's usually in our daily huddles that we have at every site that those kinds of patients are immediately identified and discussed.
Thank you. That's really reassuring. Thank you, Mina. So there's a good question about if English isn't your first language and completing the forms. And I know that's something we are always trying to find different ways to help patients where English isn't their first language. Simon or Maxine or Tala, would you like to take that? Who shouts first?
So, okay, with forms.
So we all come in together.
Okay. So we're really fortunate, a lot of our sites. We still have people answering our phones who are able to help people through forms. And a number of our receptionists at a number of our sites speak a variety of different languages and are able to still do that to help our patients. But actually, one of the other things that's slightly easier with an online form is most people on their smartphones or however they're trying to access the Rapid Health form have access to translation devices and are able to use that to translate some of the forms that are there. So these facilities are available.
Thank you. And we are actively always looking at different technologies and different ways we can help patients if English isn't their first language. We're rest assured we are looking at constantly, and anyone who develops that will be very welcome to come and speak to us. So good question. What does the merger mean in terms of benefits and easy access? Asking about the merger. Mina?
Well, I think what we're trying to say is that the merger will not change the way you access your GP surgery. That access will remain what you have now. However, what we're saying is that we are able to make sure that there are different professionals available in every site to be able to see patients. They won't have to log on to different systems. Everything they do will be much more seamless. So we will also be able to cover sick leave, unscheduled leave. Everybody gets hit by people who are unable to be in that day. We'll also be able to move patients around much more easily so that instead of having to ask patients to rebook, we'll be able to continue to see them on the day because we'll be able to move clinicians around better.
Thank you. So just a reminder, because obviously some people are joining partway through. Sorry, Maxine, to pick on you again. So will ordering the repeat prescriptions via the NHS app stay the same?
Yes, that will stay the same. What you might do is during the period of time which we've gone over and will be available on the slide, there may be you may receive a message from the NHS app for a 24-hour period to say that it's unavailable due to the merging of the clinical system. That's already set up to happen. It may also be that your NHS app access may need resetting within the clinical system. For the majority of people, it will run smoothly. For some, we may have to just ask to reset your ID verification within your clinical system.
So I think we hope it's going to run smoothly, but there'll be a disruption for a period of time. And then if you find after that you haven't got access, then they should contact the practice to get re-linked in from their NHS app. There's some feedback about reception teams and customer service and talking to patients, which I think we can take away from here in terms of people haven't always had the best experience. I know that's not the majority, but I think, Maxine, do you want to say anything about how we train our team and how we're working to better how we communicate with patients?
Yeah, so we do a monthly audit on quality of phone calls. We do look at any complaints that come in. We do regular customer service update for our reception staff. The next one is going to be in March. So we do use kind of like scenarios where it's happened, so that we can continue to improve our customer service for everybody.
Thank you. So someone's asked a devil's advocate question of, what are the disadvantages of merging? Mina, I'm going to put you on the spot.
So I'm actually struggling to see what the disadvantages are, to be perfectly honest, because actually a lot of what our patients will see will be exactly the same. They're still going to their site. They're still going to see the same people they get to see. They may have an enhanced number of different types of people they see, like Simon alluded to before. We have got an excellent diabetes team. That diabetes team will be able to move around so much better with the shared clinical record. With the shared clinical record, they'll be able to identify which patients need more help with their diabetes. So if they look at the data and the data says, well, actually, there's a whole load at Handsworth Wood that need a bit more help and support, they'll be able to put on more clinics there. So for me, I'm really struggling about what the downside is of the merger, because I really genuinely believe that we will be able to adjust our workforce so much better for the needs of the patients. And in terms of us and our administrative side, again, it's the same thing. We have a better overview of what is happening on a daily basis. It's difficult for people to understand the idiosyncrasies of the IT system that we work with. If I, sitting at Enki, somebody phones me to say, look, your speciality is elderly care, I want to ask you a question from Handsworth Wood, I can't speak to that person and look at the notes without shutting down my system at Enki and then going onto the system at Handsworth Wood to log on at Handsworth Wood to then look at that patient record, speak to Dr. Butler and say, well, actually, I think we should be doing this. Then I have to shut down that system and go back onto the system where I'm sitting. It's mind-blowingly slow and difficult to engage with 3 different platforms. It's so much simpler to have it on one system.
Thanks, Mina. There's a question about technology and people having access to smartphones. And we know that not everybody has a smartphone, and we accept that. And I think for those, and we do communicate in every sphere, whether it's banking or wherever it is, text messages and emails are used a lot. And if you don't have a smartphone, that can be quite difficult. But Maxine, reassure people they can contact us by phone and receive the same service as though they'd done it on their smartphone, right?
Yeah, absolutely. I mean, technology has allowed us to actually have more access to our patients that do struggle to get hold of us. So it's freeing up vital phone time for some of our reception staff to be able to deal, and our care coordinators to be able to deal with those issues.
However, I do have to say that there is an absolutely national, huge governmental push to get people using the NHS app, because you can do so much more with it. You can see your records, you can book your GP appointments, you can organise your repeat prescriptions, and it will have more functionality, as Mina said earlier, when you'll be able to interact with some of the hospital systems slightly better soon.
Yeah,
and can I just add on to that as well, that Rapid Health is in a queue waiting to be added to the NHS app system. It's already approved, it's been approved for several months, but as you can imagine, technology is moving very quickly. So all the providers are waiting in a queue to get on board with the NHS app.
Thanks, Maxine. There's a question about, and I think it's about Handsworth Wood electronic check-in screen that isn't working. I knew it was Simon, are you there?
It's one of the banes of my life. So the way funding works in the NHS, we do not fund any of our IT systems. These are funded centrally, and we had been waiting for ages for IT check-in screens. And we finally had a change, and the software isn't compatible. The check-in screens at Handsworth are not provided by us, and they are not serviced by us. And I have to say, it is an eternal frustration, because it would be so much easier for people if they could come in and just check and the machines could tell people where to go. I do apologise for that. I think we are onto the IT team at the ICB pretty much every day, well, every week, if not every day, about issues with it. But they are not something that are bought or maintained by us, unfortunately, which is ridiculous.
Maybe we'll send them a copy of the recording and they can see that people are the actual patients are finding it frustrating as well.
Staff at Handsworth Wood are finding it very frustrating as well. We would love to have more of them. We would love to have them working properly.
That's good. So someone has raised a good point that at the moment on the NHS app, because we're using Rapid Health and Rapid Health isn't in the NHS app, you cannot book appointments through the NHS app. But that functionality, as Rapid Health, I think, is embedded into the NHS app, will become more available to patients. But at the moment, it's go through the website, or that way, if you get sent a link to be able to book your appointments through Rapid Health.
Just regarding the screens, I've just had a message that the screens at Handsworth Wood are fixed today, and they should be working from today.
What did you do, Tana? Did you just go like that? That's amazing. That's very good. Excellent news. Thank you. There's a good question about Rapid Health and continuity of care. If someone's wanting a follow-up appointment, they go through the process, and then the doctor that they want to speak to about their test result isn't available that day. How should they manage that? It's a good question. It's not easy to answer.
Yeah. Shall I start? One of the things that we have across the whole of medicine, really, not just in primary care, but many doctors are choosing to work part-time. And because of that, it is often difficult to get to see the same person, as you say, to discuss a blood test with the person who's already spoken to you in the first place about having it. And it's really lovely to be able to have continuity of care. Now, when the doctor does send you the link to have an appointment, they can send the link to have an appointment with a certain group of people, enabling continuity of care. But also, please be reassured that doctors make really good notes in the clinical records. And so the reason for the test and the management plan, we do encourage all of our doctors to put that into the notes, so that if you do have a different person that you are consulting with, that person does know what was discussed, why the test was done, and what the actions should be following the results of the tests.
That's really reassuring. Thank you, Mina. So we've only got a few minutes left. There's a question that's just come in, and I think I might have confused it. Said, should I be booking appointments through the website and not through the NHS app? I'm more confused now. So to book your appointment for these 3 practices or any of the Birmingham practices, you should go onto the website and of that practice and use the Rapid Health link to go through and follow that process through. That's the best way to get. Or if you're not comfortable or confident in doing that, you can telephone the practice and they will help you complete the form over the phone. I don't know. I'm hoping we haven't missed many questions out. I will check back after the event because someone said we haven't answered everything. Yes, you'll be able to enter in the chat later. I'll try and keep a monitor of the chat and get someone to keep an eye on it to make sure we don't miss anything. And I think that is pretty much nearly all we've got time for. I don't know who would like to do. Simon, would you like to do a summing up at the end to say what would you?
Just to say, thank you everybody for attending. We really appreciate it. It's always difficult when there is change, but actually what we'd all like to reassure all patients is that the services at your practices will continue, and actually hopefully this will make us more resilient. So please don't worry. Yes, there will be some short-term disruption, as Maxine has alluded to, over the end of the end of next week, the beginning of the week afterwards for Handsworth Wood, and a week later for Laurie Pike, with Enki on specific days as well. We are pushing as quickly as possible to get service resumed following that. But yes, thank you all for bearing with us. And as I said, we hope this will not change the service you receive at your sites, but actually make your service more resilient.
That's brilliant. And just last thing for me to say is thank you everyone for joining us. Like Simon said, this is recorded, so you can watch it back if you've missed the beginning, or share it with other patients that you know that may have missed out. And thank you to everyone, Simon, Maxine, Mina and Tyler, for joining us on screen today and being brave and coming online, speaking to everybody. Really appreciate it. And thank you all, and we shall see you soon. Bye.
Thank you, everyone.
Lois, if I can just make a very brief point, I think the aim of all these changes is for you, the patients. The core of our belief, the reason why we're doing this, is to provide good quality of care for the population. We want to make the journey for the patient seamless from the minute you request an appointment to seeing a clinician. And the main issue we see in general practice is the access to getting appointments. So all these changes are being done for you and for your benefit. And we value your patience, and bear with us while we just get things set up correctly, working to full standard. And I assure you, you will have a good experience with us.
Thanks so much. That's very, very true. And thanks everyone for joining us. See you later. Bye.
Thank you. Bye.
Bye-bye.